TB HIV Care has got a very rich history. 1929 to 2019, 90 years. Happy birthday, TB HIV Care. I think Isaac Newton said it best. We see so far because we stand on the shoulders of giants. And of course, TB HIV Care has seen some giants in our past.
I joined 2011. I was obviously introduced to Ria, and Ria wanted to take me on a trip down memory lane. So basically it was her way of orientation. In fact, what was interesting was that, she told me a story that back in the day there was no cure for TB, and that people would just go to the mountain and, through sun, and basically that's how TB was cured. And I think when I went to Khayelitsha, she was just sharing with me, how it was when they started TB. It was TB Care at that time, and basically how it evolved to TB HIV Care. And basically her memories of when she started as a caseworker in TB and how she was involved in TB and the passion for TB and how she ended up, finding this organization.
She was a nurse by nature and by profession, and she was that sort of a person in her life as well. But it was something that meant a lot to her. TB was an issue and she wanted to provide support on a very significant issue. Yeah, well, it was a very different political environment generally in South Africa. In those days it was divisive and all of those things, and whatever else happened anywhere else is the same sort of thing that happened with medical services. So they were separated and that sort of thing. So it basically, apartheid was apartheid. And
so Ria told me a story about the TB grants that were being issued by the government. And these TB grants, she was telling me that there were inequalities, due to race. So the black patients would get 12 Rand and, the other races would get more than that. And of course, she was very disturbed by that. But, the issue of race with her was very important, and that was touching. So around the 1976 riots, and just this speaks to the passion that she has. It made it difficult for clients to get medication, and that they would hire buses. I seem to recall that it was Mutale Bus Services that would take clients, I think, to Chapel Street in Woodstock for them to be able to get medication, because it was very difficult for them to access medication due to those riots. And again, so, for me, that was speaking to the kind of caring leader that Ria Grant was.
Ria was our director, our CEO, our manager, our PR. She was the HR as well. Everything. She just did everything. But we were only 3 staff members, and with Ria 4. In 1991, I came on board as a TB caseworker. I needed to go and visit all the clinics that was within the care of TB HIV Care, and it was TB patients that we needed to see. So you would go into a clinic and you would go and sit and you would talk to the patients and listen to their problems. In other words, you'd be a counselor. The other key turning point for the organization was having what they call directly observed treatment, the DOTS program, where the result is now TB Care needed to start employing volunteers out of the community. And she said she called that particular program On the Street Where I Live. Ria loved music. She couldn't sing a single note properly, but she loved music.
I was staying at an informal settlement at Sweet Home Farm. It's where I started to join TB Care then. People used to say the TB is killing them, and I just volunteered myself to accompany them, to take them from the community to the clinic. And remember, it's not nearby. We walk a bit distance from the place where we stay until to the clinic. A dot supporter is a person who goes to the clinic and get medication for those who are supposed to get, and then the people will be told to go at your house and take their medication. The advantage of this system is because the client would go to the same community where she or he stays. Then he or she will arrange the time of coming to get this medication to you, that if that person is working, is better and going back to work, that person can come even like in the evenings to get medication.
Then we had something coming up that was on the horizon, and that was HIV. And we didn't have a clue how HIV worked or what it was all about. It was to us something very new. And we had Professor Harry Hausler on board. Wow. He brought the HIV world with him. And now TB and HIV were truly working together. The name TB HIV says it all about this organization.
Well, in fact, Rio was also quite excited about this when I joined, because the link between TB and HIV is so clear in South Africa, with 60% of people with TB also being co-infected with HIV. So we started with an integrated adherence pilot funded by the National Department of Health that was very successful. And in fact, then it became, over time, the standard of care throughout the Cape Metro. So from community dot supporters being paid a certain amount per patient per month, they received a standardized stipend to support both people with TB, with HIV alone, or with co-infection. TB HIV Care has always been serving an unmet need. We came from the community, we were serving the needs of the community, and we're an extension of the Department of Health. So we were able to work in partnership with the department to reach people who wouldn't otherwise be reached. And we're also able to provide services to particularly vulnerable populations. So key populations for HIV, including sex workers and people who inject drugs, men who have sex with men. Then inmates in correctional services, who are both a key population for HIV and TB, because they're very much at risk for both. And we're able to reach those people because we provide peer-led outreach services involving and employing peers from those communities and are able to engage with other people from those communities.
I think, though, the trigger from moving from an association status was brought about in October 2016. We were awarded under the CDC PEPFAR grant a prime status. This led to the formation of a consortium with 13 sub-partners and an operating budget of many, many millions of dollars. Interestingly enough, only in 2008, TB HIV Care had around about 120 members of staff. And so the growth from 2008 to 2019 has been tremendous. We now operate with 1,650 members of staff from 120 in 2008. At the same time, back in 1929, we had a presence in one metro, which was the Cape Metro, with very few staff members, whereas today we operate across 8 provinces with 25 districts.
The organization has survived for 90 years because of resilience, and I think also because the vision is clear. I think TB HIV can know exactly what they want to do, and also they have a very dynamic leader through Professor Hausler, who's able to understand what the community's needs are and try and have programs that respond to those. And of course, it has very dynamic people that are working for it.
South Africa is home to less than 1% of the world's population, and yet we have 18% of the HIV burden. That's 7.9 million people living with HIV. We're ranked 3rd in the TB incidence, and we're also home to multi-drug resistant TB. That's a lot of work to do, and I think TB HIV Care is doing it very well.
I feel so privileged to be leading this organization. I think because the vision and the values really resonate with me. To empower communities to be healthy and free of TB and HIV, and to live the values of professionalism, empowerment, appreciation, and respect. Those are the things that really drive me day to day.
When I see TB HIV Care, I see a huge difference in our communities in terms of empowering people, because I could say it from me, because I'm the first example either than other people. It empowers people, and it also educates our communities.
And this organization is growing stronger. I remember the first time I said in a meeting with Ria, she said, "What is your vision for TB HIV Care?" I said that it may become the best known TB organization nationally as well as internationally. And I think when I look at it today, TB HIV Care really has become that. It has become an organization that put out best practices for dealing with TB and HIV, but not only that, for dealing with the empowerment of community, the empowerment of whoever walks into their doors. You do not leave the place the same person.